I'm Jessica Gerskis, Product Manager for Cirrus at Carl Zeiss Meditech. As the world's leading innovator in optical coherence tomography, Zeiss has been at the forefront of industry-defining advancements that have made the OCT the standard of care in the evaluation of ocular health. OCT allows eye care professionals to non-invasively image ocular structures on the microscopic level and has become an essential tool in the management of chronic, sight-threatening conditions such as macular degeneration, diabetic retinopathy, and glaucoma. Zeiss introduced the first commercially available ophthalmic OCT in 1996 and has since introduced next-generation Cirrus HD-OCT featuring high-resolution spectral domain OCT technology. In 2015, Zeiss again set the pace in OCT innovation, being the first to gain FDA clearance for OCT angiography with Cirrus's AngioPlex, which provides non-invasive, three-dimensional visualizations of the retinal microvasculature. To date, the Cirrus family of products has gained significant adoption and is the most popular OCT in the market for eye care professionals. The OCT itself allows for visualization of the structure of the retina and precise measurements compared to a normative database. Cirrus has a number of tools that work together to deliver a comprehensive assessment of your patient's retinal condition. PanoMap is often used for patient education as an overall assessment of eye health. This easy-to-interpret single-page report combines information from both the macula and optic nerve head to provide an integrated wide-field assessment of the RNFL and ganglion cell interplexiform layer thickness. All of these parameters are compared to a comprehensive normative database. Compared to other devices, only Cirrus has event and trend-based progression analysis that can aid in identifying glaucomatous progression. Additionally, closed-angle glaucoma can also be assessed with Cirrus's anterior segment imaging. These combined analyses give our doctors a comprehensive glaucoma package, allowing them to monitor their patients longer with more confidence to help better pinpoint the optimal time to refer. Let's look at a case that integrates a few of Cirrus's key features. This patient is known to have diabetes. Let's look at the macular thickness OU analysis. Here, the values in regards to retinal thickness are green, which means they are in the normative range based on conventional OCT. One may or may not consider a fluorescein angiography at this point on an otherwise normal-looking macula. But let's dive deeper and take a look at the retinal vasculature with one additional AngioPlex scan. There are a couple things you'll notice here. In this location, yet extremely subtle, is a microaneurysm where you can see the flow in the B-scan if I position the markers just right. Here, you can start to see a ragged or broken FAZ. You can see the disconnected vessel here in comparison to a normal eye. This is not something you would otherwise be able to see clinically. But with the combined power of OCT and OCTA, you can see the early signs of diabetic changes within this patient. AngioPlex, as you saw in the last example, allows us to visualize the retinal and choroidal structure as well as the vasculature from a single scan without the need for contrast dye injection. And now Cirrus has wide-field AngioPlex, which shows more than a traditional 50-degree fundus camera and up to 3 times larger than other montage OCTAs on the market. You can see here, central to the peripheral retina, a must-have tool for diabetic retinopathy. AngioPlex also has a scan that is optimized for the optic nerve head, where we can get new insights into monitoring disease process and changes in glaucoma. AngioPlex can visualize the RPC network where traditional fluorescein angiography cannot. Other key differentiators of Cirrus include Fast Track, an eye tracking technology that actively tracks the eye during the scanning for motion artifact-free images, and also tracks to prior, where scans are taken from the exact same location as a previous visit to ensure precise visit-to-visit comparisons. Pachymetry, which measures and maps corneal thickness. HD corneal imaging, with tools for measurement and annotations. Epithelial thickness mapping, where thinning may reveal signs of early keratoconus. Cirrus is the trusted and proven clinical platform offering comprehensive assessment of macula, glaucoma, and anterior segment with wide field visualizations and a high ease of use, addressing the challenges of high throughput clinics. Its data compatibility and integration with other modalities from Zeiss strengthens the integrated diagnostic imaging platform unique to Zeiss. Whether you're starting out or a specialist, there's a Cirrus with you in mind. Talk to a Zeiss representative for further information on the capabilities of Cirrus.